This is the Behind the Line podcast, and this is Pacific Northwest Headline News in 3 minutes for Thursday, January 27th, 2022. A bill has been introduced in Oregon to allow everyone to pump their own gas. Oregon is just one of 2 states in the U.S. that does not allow people to pump their own gas. They've tried to pass similar bills in the past that have failed. However, now with the pandemic and staffing shortages, they feel this could be a good time for it to actually pass. The New York Times is running an opinion piece today on Oregon. It's called "Treating Addiction as a Crime Doesn't Work. What Oregon is Doing Just Might." Because Oregon has decriminalized drugs. And in it says, to reduce stigma and improve the addiction crisis, drug policy must be liberated from the idea that without criminal penalties, no one would ever quit drugs. Because far from spurring recovery, arrest, incarceration, and having a criminal record can exacerbate drug problems. Well, also in the news today, in a survey released from the Substance Abuse and Mental Health Services Administration, Oregon ranks second in the country for substance use disorder. Oregon ranks first in the country for both opioid misuse and methamphetamine misuse rate. The survey stated meth usage skyrocketed during the same time period examined, seeing a 53% increase from 2019. State officials said between 2019 and 2020, alcohol-related deaths had increased 73%, and drug overdoses had increased 39%. I'm not entirely sure decriminalizing hard drugs works. California state health officials say that it appears California has passed the peak of the Omicron wave variant. But don't get too excited. They're concerned about the new sub-variant BA2. They've detected 14 whole cases of it, and they're not sure how serious, infectious it could be. You know, this is the one that goes undetected. Washington State's paid family leave program could hit a deficit as early as March, and there are concerns about long-term solvency following a significant increase in demand for the benefit that launched in 2020. Under the law, eligible workers receive 12 weeks paid time off for the birth or adoption of a child or for a serious medical condition of the worker or the worker's family member, or 16 weeks for a combination of both. An additional 2 weeks may be used if there is a serious health condition with pregnancy. Weekly benefits are calculated based on a percentage of the employee's wages, which is now $1,475 through the weekly amount paid out is capped at $1,327. In the first 6 weeks, they saw triple the amount expected had applied for the program. The department passed more than 365,000 individual applications and paid out more than $2.2 million in weekly claims. Imagine that, a Democrat welfare program insolvent. This has been Pacific Northwest Headline News in 3 minutes. For more, visit BehindTheLinePodcast.com. Thanks for listening.